Hi everyone. This video will be talking about the core concepts of pharmacology. Pharmacology comes from two Greek words, pharmakon, which means medicine or drugs, and logos, which means study. So simply put, pharmacology is the study of drugs. As nurses, it's really important for you to understand how drugs are administered, where they travel to in the body, and the effects that they have on our bodies. It's very important for you to also have some basic knowledge of pathophysiology and anatomy, and also maybe some chemistry and microbiology as well. If you try to learn all about these drugs in isolation from diseases or medical conditions, you might have a harder time seeing the rationale for the therapeutic reasons why we give certain drugs. There are literally thousands of medications currently on the market right now, and I expect you to memorize every single one of them. I'm just kidding. It would be impossible for you to memorize them all. But what I will teach you is the therapeutic classification of those drugs, and you'll be able to find out where that information is, and you'll be able to understand the interactions of those drugs, their mechanism of action, and their side effects. So you'll be able to demonstrate also the nursing process that's involved in medication administration, and more importantly as well, patient teaching, so that you're prepared to be able to tell the patient what they're receiving and why. Throughout this course, you're going to develop a working knowledge of the commonly used drugs in healthcare today. Pharmacology is changing on a daily basis. What was the drug of choice a year ago may not be the drug of choice today. You can't learn pharmacology in one day and expect that to be the end of it. It's a lifelong journey, and that's why I say it's a working knowledge. Every day you're working towards understanding it better. Drugs can elicit a different response for different people. There are a lot of individual factors that can change the way a drug has an effect on somebody, such as age, gender, their body mass, their health status, genetics, their nutrition, lots of factors. Keeping current with new drugs that are being introduced every year can be extremely challenging. But I want to encourage you to try to keep current, especially with the drugs in your area of specialty. So if you're in cardiac care, it'll be really important for you to keep abreast of all the new cardiac medications, frontline drugs, drugs of choice that are being used, and keep up with the new and updated ones that are changing. So that would be my advice to you. One thing that you need to keep in mind as we move forward is that pharmacology needs to be approached with reverence and respect. If applied unsafely and without any critical thinking, the consequences of drug administration and errors can be devastating, not only for your patient, but for loved ones around that patient, and for you and your career. So as we move forward, let's look at this as a challenging course, but a rewarding one in which that you will grow in confidence and that we'll learn together.